Well, hello, Douglas White here from the American Academy of Orthopedic Physical Therapy. The Scope of Practice Task Force is doing this project on rural health, and we're interviewing different physical therapists practicing in rural health environments. And today I have with me Lori Swanton, who's in Cody, Wyoming, and we'll have a little chat about rural health practice in Cody, Wyoming. So, Laurie, if you could introduce yourself a little bit and tell me about your practice environment.
Sure. So as you said, Lori Swanton, and I am practicing in Cody, Wyoming, which is, a town of 9,000 people serving a much larger area, remote area. And I have a private practice, cash-based physical therapy practice in Cody. And I'm the sole practitioner here in the practice, but have practiced in some of the other clinics here, more traditional based PT. Yeah. Anything else you want to know?
Well, what do you find rewarding about where you're practicing now?
Well, I think practicing anywhere you can find it rewarding, right? Just in our profession and what we do, of course. And so specific to where I'm at, what comes to mind for me is the type of practice I have set up, being a little more specialized practice, not necessarily seeing just post-op, but post-op care, that sort of thing, trying to be a point of access for people into the medical system. Because they may not have that access here to, first go to a specialist or that sort of thing. So I find it very rewarding to be that point of access and being able to use a multi-system approach and screening and helping patients to determine if PT is appropriate, but what is their path through the healthcare industry and the healthcare fields and what's available and not in my particular community and setting. So,
Well, that's great.
Save the date for the 2024 AOMPT Conference, October 23rd to the 27th in Orlando, Florida. Join OMPT professionals for 5 days of continuing education focused on OMPT, hands-on learning, research, networking, and more. Visit aaompt.org for more information.
What would you say to encourage your colleagues to practice in a rural setting?
I think it comes with its own advantages and challenges. And, I feel like it lends itself to an incredible amount of autonomy in practice, right? Of being that point of access and being able to be the first person to help try to pull things together and guide a patient through their healthcare journey. And I think that's unique, being in a rural community, right? Of not necessarily having them jump to a specialist that may not be available, that they think they should, that the patient would think that's where they need to start, right? And so that autonomy of practice of really being able to work in a differential diagnosis and pulling together all of our knowledge base and really being able to do a deep dive with the patient, to understand where they're at, what their challenges are, being in a rural community, be it whatever, their mindset, and helping to really differentiate their care, that it can be different than the traditional path, right? And so I find that very exciting in a rural community to be able to work with the patients at that level. Not being like, they're not sent to me from a specialist, for instance, or maybe not even from an orthopedist, or, I'm the one that's getting to start to decide what's the best path for them instead of the maybe traditional insurance-based models, that interestingly, I think a rural community has helped me be able to do that. Right?
Yeah, no, that's interesting and very, 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 I can relate to that very much. Um, so what are some of the barriers that you found in the community and where you're practicing?
What comes to mind first when you say that is I feel there's an idea that practitioners, myself included, right, living in a rural community are not highly educated, that we're not from a university backed hospital situation, right? And yet I'm a fellowship trained physical therapist, right? And so I think that is a challenge of this idea that they're not getting optimal care. Of course, once they're in my doors, that fully changes, but that is a barrier, right? That people have this idea of they need to go to whatever Mayo Clinic or something bigger, and that good quality practitioners aren't available in a rural setting. And it's like, well, really highly educated and highly qualified practitioners, PTs and otherwise, want to live in rural settings as well, right? So I think that's one barrier. And then of course, another is it's collaborative care is challenging, right? When you do feel like you need to bring on other expertise into the situation and not having immediate access to that, where you can't refer someone to just go down the street because you think they need specialized testing, or that would be beneficial for them. It is a challenge to help the patient to find those resources that may be a plane ride away now, or they, right? I mean, virtual healthcare has helped as that's become more readily available and accessible to people. But yeah, I mean, that's definitely a challenge, right? It's like, it's the beauty of being in a rural setting and treating, and it's also the barrier, right, of not really having that easily accessible collaborative care for the patient.
Yeah, I can certainly relate to that. And that you spoke to the perception of people not thinking that there's highly qualified practitioners in rural environments and that kind of thing. I take from that the perception is more coming from people who are not in a rural environment, as opposed to people in the rural environment who seek out and are highly appreciative of the highly qualified providers that are there, and you get a lot of value and appreciation from them because they really value what they have.
Oh, absolutely. Like that, like once they're in the door, that shifts, right? They're like, oh my goodness, like thank goodness I didn't have to get on a plane and go somewhere for this level of care or specialization, right? Absolutely. But I do feel there's still that sometimes the re-education that's needed for people. Like you don't have to go to a bigger city, a bigger community, a bigger hospital system, or for instance, right, to get that quality of care. So it's just an opportunity for education also, right? But absolutely, I think overall, you're exactly right that people are insanely appreciative, right? And surprised sometimes that they can get the level of care that we can offer. Yeah.
That's great. So anything else that you could add that you've talked about it somewhat already, but anything else you could add that how your patient management is different because of your environment than it would be in a different environment?
Well, I have had to figure out how to provide virtual care, because is it ideal? I mean, I'm a manual therapist, right? It's challenging to kind of move away from what we're comfortable with, what we're used to. But the reality is everyone can't get here from 100 miles away, right? They live in I am the point of access, but it's still too unattainable. So having to learn how to do a physical therapy evaluation virtually, and to recognize that we have a lot of tools and a lot of education to provide to people, even if we can't get our hands on them and we can't, whatever, assess their joint mobility. And so that piece it's been a journey, right? Of coming up against my own limiting beliefs about it, but also just like, how can we provide quality care and feeling that it's quality care when maybe they can't come as frequently, or they point blank can't get here because of transportation issues or weather or what, all the things that can happen, right? So yeah, that having a virtual side of my practice has become key, honestly, to serving people in a rural setting, right? And so adapting with that. Yeah, so that's one area that I feel is a little different.
As a dedicated orthopedic physical therapist, you understand the importance of staying current with the latest techniques to better serve your patients. With gait analysis, continuing education, and technology, RunDNA is committed to accelerating your expertise so you can help runners achieve their best. Visit rundna.com/AOPT to learn more and get your free ebook, Top 5 Things Running Professionals Need to Know.
You can also, I assume the virtual aspect, you're screening people and you can help them virtually too, but also helps you identify when you say, hey, I really need you to come into the office because this is something that we need to be face to face to work on and do that. And so it's a good screening opportunity too as well. So yeah, I can appreciate that. That's great.
And really, it has forced me to really expand on like building up patients' efficacy in their own care, and really being able to pull out a lot of these lifestyle pieces that are very pertinent to their care. Like when they're in person, it's easy to go, you need to do whatever, these exercises, or we need to do this manual treatment or this modality. But now really capitalizing on this person as a whole, in their lifestyle, in their environment, and all of these pieces that we want to bring into physical therapy, as far as talking about whatever, nutrition and their support structure and their sleep quality and those lifestyle pieces. So I think also really amplifying that side of physical therapy and patient care has been pertinent for the success of my patients in this virtually, but also just in a rural setting, again, where they don't have as many resources available. So really helping them to take control of their life and their world, in addition to just their physical therapy, traditional physical therapy, like exercises or something of that nature, right? And so, yeah, I think
holistic primary care kind of care.
Oh, absolutely, wholeheartedly, yes.
Yeah, well, that's all the questions I have. I really appreciate you taking your time. Lori Swanton from Cody, Wyoming. Thank you once again.
Absolutely, thank you.